Hi, my name is Ryan. I'm a student at Nightingale College. Today I'll be performing a head-to-toe assessment on my patient. First thing I'll do, I'll knock on the door, enter, close the door behind me for patient privacy. I'll do hand hygiene and I'll put on some gloves. Introduce myself to the patient. Hi, my name is Ryan. I'll be your nurse today. What's your first and last name and date of birth?
Michelle Tran, 12/4/82.
Happy birthday. First thing I would do is I would check a set of vital signs. Are you in any pain right now?
No.
No pain. So 0 on the pain scale. We're just going to verbalize the vitals. So temperature is 94, pulse is 63, blood pressure is 112/82, the respiratory rate is 16, can't forget pulse is 62, and oxygen saturation is 99%. All right. Next I would verbalize any findings with my patient and with my audience here. So we'll start out head to toe. First thing I'm gonna do, I'm gonna, for head, ears, eyes, nose, throat, I'm gonna start with visualizing the eyes. So I'm gonna use my pen light, look for pupillary constriction. Okay, good pupillary constriction. I'm gonna hold the light on you. Can you look at my finger over here? All right, and good. A good accommodation. I'm gonna visualize the sclera, make sure there's no discharge in the conjunctiva. No discharge from the conjunctiva, and the sclera is clear. I'm going to, okay, if I palpate your nose, I'm going to be checking the sinuses. Up here. Do you feel any pain right now? No tenderness?
No.
Okay, palpate the nose. Nose equal, nostrils look clear, septum is midline. No discharge from the nostrils, and again I said septum is midline. Nose is symmetrical. I'm going to go to the mouth next. I'm going to have the patient breathe through each of their nostrils. So go ahead and you're going to plug one side of your nostril and breathe in and out through the other. All right. And that's good patency. So patient's lips are pink and moist. Go ahead and open your mouth for me. I'm going to view their tonsils. Tonsils are intact, not swollen. They have all their teeth and their gums are not bleeding. Go ahead and stick your tongue out and move it side to side for me. That's going to check the hypoglossal nerve. All right, that looks good. I'm going to now assess their ears. Turn your head that way for me, please. I'm going to see if I can. I'm going to look at the tympanic membrane. Make sure there's no discharge. No discharge, and I can see the tympanic membrane. Pardon me. All right, I can see the tympanic membrane on that side, and there's no discharge in that ear either. I'm going to palpate your neck, feel the lymph nodes, look for any tracheal deviation. Trachea is midline. There is no swollen lymph nodes and no jugular vein distension either. I'll now move down to cardiac. So I'm going to listen to your heart. Actually, I'm going to do lung sounds respiratory first. So I'm going to listen to lung sounds. Go ahead and take a deep breath for me. Good. Side. Okay. Okay. All right, can you sit up for me? Go ahead and take a deep breath. Okay. All right. All right. Good. Lungs are clear and equal in anterior and posterior. I'm going to check for equal rise and fall and symmetry of the chest. Go ahead and take a deep breath for me, please. All right. Chest is equal. Have you had any cough at all?
Yes, I did.
You have? Do you have any? Is there any productive cough or any sputum?
No.
No. Okay. Any shortness of breath?
No.
No? Okay, I'll move on to cardiac now. I'm going to listen to the lung sound, or listen to the heart. All right, heart sounds good. Sounds like a sinus rhythm. I'm going to check radial and pedal pulses bilaterally. Radial pulses are +2 bilaterally. I'm going to check pedal pulses now. Pedal pulses are +2 bilaterally. I'm going to check cap refill on both her hands and her feet as well. All right, under 2 seconds on the hands. Under 2 seconds on the feet. All right, we will now do abdominal assessment. Can I lift your shirt up a little bit?
Sure.
I'm going to first inspect it. Thank you. So I'm going to be looking for any pulsating masses or any abdominal distension. There is none. I will also take next. I'll start out in the right lower quadrant. And you listen for 5 minutes per quadrant. We're just going to do a little bit fast that for the video here, for video's sake. Patient has normal active bowel sounds. I'm going to palpate next, so you can feel a little pressure. Let me know if there's any pain on pushing or any pain on releasing, which would be rebound tenderness, okay? Any pain?
Nope.
All right, no pain, and I did not feel any masses or anything abnormal on palpation. When was your last bowel movement?
Oh, this morning.
This morning, okay. Normal, do you normally take a bowel movement every morning?
Yes.
All right.
My copy.
All right, bowels are normal. Next I'm gonna do my, the integumentary and head to toe. Don't mind the other patients here. So I'm gonna be starting at the top, working my way down. I'm gonna look for any hair loss. Hair looks okay, hair is intact. And all right, so I'm looking for any deformities, contusions, abrasions, punctures, tenderness, lacerations, burns, or swelling, or any rashes. I'm going to be checking bony prominences for any skin breakdown. So head to toe, we look good in the head, look good in the arms, no tenderness. Looks okay. I'm going to check the wrists for bony prominence, no skin breakdown. No skin breakdown. I'm going to work going down the legs, no tenderness. All right, and check the ankles. No skin breakdown, the bony prominence there. I'd have the patient roll over. I'd check their sacrum for any skin breakdown there too, since that's another bony prominence, a common place for skin breakdown. I would then do musculoskeletal next. Can I have you sit up for me and sit on the side here? I'm going to do function and range of motion. So first, can I have you just kind of do your shoulders out to side, make a circular motion, all right, and up and down. A good range of motion on those. On your arms, I'm going to be doing a push-pull. So I'm going to be pulling, you're going to be pushing, you're going to be resisting me. So you're going to bend your arms, and I'm going to try and straighten them, you're going to bend them, okay? Good. And now you're going to push. Good. And we're going to do the same for your legs here. Maybe can you straighten and bend them? Good. So I'm going to push your, you're going to try and straighten them, I'm going to push down them, okay? Good. And now you're going to resist. Good. And we're going to do the same for your feet. Push, pull. I guess that's the opposite, push, pull. All right. And go ahead and move your ankles around. Good range of motion in the ankles. I'm now going to assess the patient's gait. Can you stand up for me? All All right. Do you have any joint pain?
No.
Okay, no joint pain. All right, I'm gonna have you just walk around a little bit. I'm gonna assess their gait, make sure they've got good center of gravity, make sure you've got good balance. They've got strong gait, good center of gravity. All right, go ahead and have a seat. I'm gonna ask you the same question I did earlier. What's your name?
Michelle Tran.
And do you know where you are right now?
Oh, I'm in the house.
And do you know what month it is?
I believe it's December.
Okay. Patient's A&O times 3. A&O times 3. And I think that concludes our test. So I will then remove my gloves, throw them in the trash, perform hand hygiene. If the patient has any other questions or I need to do any education for the patient, I would do that now. Otherwise, I would leave the room, close the door, wash my hands, and document what I've done. And voila, we've done a head-to-toe assessment on our patient.